Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Case 2. Postmenopausal female who is age group of 60 to 65 years of age with prolapse and has contraindications of surgery like diabetes or hypertension. Here, if the patient has contraindication for surgery, definitely it is not safe to give anesthesia for a longer period of time and we cannot do surgery because of the contraindication. In such case, we do Lefort's colpoclysis is done. So in such case, we do Lefort colpoclysis is done. So in Lefort colpoclysis, Leaford colpoclysis is done. Leaford colpoclysis is not done in younger individuals because the coital function is hampered and there will be no space for the menstrual blood to come out. So in Leaford's colpoclysis, we will scrap the anterior and posterior vaginal wall and it is done on local anesthesia. Once you scrape the anterior and posterior vaginal wall, there will be formation of adhesions due to raw area and the vaginal wall closes completely permanently. So this is used for managing the vault prolapse and it is also used for managing in females more than 65 years who are contraindicated for surgery. But this procedure can be done under local anesthesia.
thank you and thank you for watching.